your due date? 11. What? How many times have you been pregnant?
3.
This is your 3rd pregnancy?
Yes.
You have 2 babies
It's
at
in
home?
my ass.
I've never wanted to punch a nurse so hard in my life before.
Y'all treat all your patients like this or just the black ones?
Who is your doctor? When's your due date? Like, what do you think my due date is? I'm literally sitting here in this wheelchair, about to push this baby out on this floor.
She's just there with a stack of papers in her hand, screaming that this baby is coming. This baby is coming.
12 minutes later, that baby was born.
Y'all, I don't even know where to begin with this level of foolishness. 36 million people watched that video, and every single one of them had the same reaction. What in the actual hell is going on in these hospitals? Because let me tell you something. When a woman is screaming that the baby is literally in her arse, and for those who don't know, that's medical speak for this baby is coming right now. Your response should not be, let me just finish typing this real quick. That's not protocol. That's not procedure. That's just plain evil. And before some of y'all come for me saying, well, hospitals have rules. Cool, so does basic humanity. And somehow that got left out of the employee handbook at Dallas Regional Medical Center in Mesquite, Texas. So here's what you need to know. November 13th, 2025. Karrie Jones, 25 years old, very pregnant, goes into labor at home. She does everything right. Calls the hospital ahead of time. They know she's coming. And what happens when she gets there? Well, let me just show you.
Fuck.
When's your due date?
Right now.
Is your due date 11? What? How many times have you been pregnant?
3.
This is your 3rd pregnancy? You
Yes.
have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Okay, this is LaCrista Vaughn for you. Alright, last name is Jones. She's G3B2. I'm not sure when her due date is.
Her due
I
date
just
is the
said
10th.
it was the 10th.
I think her due date is the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people.
Ma'am,
Yes.
are you able to call the anesthesiologist?
Someone is coming to take you to labor and delivery.
That's not what I asked.
I cannot know.
Now I want to know. What part of that woman screaming made that nurse think, yeah, this is fine. Let me just get her insurance information first. She's literally saying the baby is crowning. And LaCrista, yeah, we got her name, don't worry, is sitting there like she's doing her online shopping. When's your due date? Girl, her due date is now. It's happening. The baby doesn't care about your intake forms. The baby is not concerned with whether or not she signed Section 4C. That baby said, I'm coming, whether you're ready or not. and apparently nobody in that waiting room was ready, except the woman actually giving birth. And can we talk about the mum for a second? Y'all treat all your patients like this? Or just the black ones? Because that is the question, isn't it? That's the question that's got people in their feelings. That's the question some of y'all don't want to answer, because the answer is uncomfortable. But we're gonna get into that, don't worry. 12 minutes. 12 minutes after this video was taken, that baby was born. Which means when LaCrista was asking about medical history, that baby was about 5 questions away from introducing itself to the linoleum. Make it make sense. Now, that viral clip, that's just a snapshot of the disaster. Because the mum, Karrie Jones, she came back and explained the whole situation. And baby, it gets worse. So buckle up, because this is where your blood pressure is about to do things. Listen to what she went through.
Hello, TikTok family. This is a follow-up on the video that I posted earlier. So I was at work. I had no idea of the activity that was going on. My daughter's texting me, calling me. I didn't know what was going on. So finally I get home, they tell me about the video, and a lot of you was asking about a follow-up and to explain the situation. So this is the situation. My daughter went into active labor at home. We took her to the hospital. She called ahead of time, so we know they are expecting us. However, we get there to the emergency room. We watching nurses, putting gloves on, running to the door. They get outside of the door, and I drive a black SUV, and they look at my vehicle, and one of the nurses come up to the window, and she goes, I'm sorry, this is for ambulance only. I said, well, my daughter is in active labor. And she was like, okay, she said, but you're going to have to go to the front. I'm like, I have to drive to the front. And they said, yeah, you have to drive to the front. Okay, another redhead. And so I'm like, so she's you hear, and it was like, yeah, she started bagging up, hit the button, went back inside the building. So I go around to the front. I get out of the car. Again, this girl is in more pain now than she was when we first left the house. And she started saying, I feel pressure, I feel pressure. I said, take deep breaths. I ran in. I said, hey, my daughter's in the car. I went to emergency. They told me I had to come to the front. So the lady was like, what's your daughter's name? Told her Karrie Jones. She gets out some paperwork, started typing in the name. I was like, ma'am, do you have a wheelchair or anything? She's in the car. I need to get her in. Oh, if you check on the other side of those doors where the vending machine's at, there should be a wheelchair out there. There's no wheelchair out there. So she gets up, she walks in the back, and she come to the door with a wheelchair. She said, here you go, ma'am. I said, excuse me, you're not going to come with me? And she was like, no. Oh, okay. So, a police officer was in the lobby. He gets up. He grabbed a wheelchair. He goes out the door with me. He said, come on, I got you. Went out there. She is on hands and knees in the back of the vehicle. And I'm like, oh, shit, what is going on? And then she goes, it's in my ass. And I was like, what? And the guy was like, and she was like, he said, okay. She was like, give me a minute. She could not move. So when that contraction eased, we put her in a wheelchair. He said, you can go park your car, because they, again, had people out there. So I went park my car. It wasn't even 30 seconds. I run back in the building. She's just there with a stack of papers in her hand, screaming that this baby is coming. This baby is coming. I look at the registers behind the window, and they looking at me, and they was like, well, we can't do anything until she signed the papers. Are you kidding me? So I grabbed the papers, and of course, it's all ER that they have, and
I was like, you want her to sign this and she's in active labor. And they was like, okay. I was like, ma'am, she was supposed to be induced earlier today at 8 o'clock. And they called and told her that they will call her because they didn't have beds. And they will let her know. And no one ever called back. They called back every hour on an hour. And they was like, no, we'll call you back. And then finally her water break, she called them. They tell her to come in. So why is she signing these papers? We need her in labor and delivery. And it was like, ma'am, I'm sorry. So the charge nurse comes out and she saw the paper signed. What? Are you serious right now? And she closes the door. And then the lady behind the window at this point, my daughter, scribbled her name on all the papers. We gave it to her. She says, thank you. She walked it around to the charge nurse. She opened up the door. My daughter is literally like having a contraction. And she's just standing there in the door. So we push her into the door. I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork. I have to do the paperwork and get her a band before we can send her upstairs. So that was the video that you guys saw that I initially posted. So the next video that has no picture on it was when I was pushing her in and we was at the window because they asked me to move her from the window so they can take care of the guests or, patients that was coming in and out. Do not go to this hospital. This hospital is ghetto as hell. They do not care about Black women or their babies. This is crazy. I read about stuff like this all the time, but to see this firsthand, this lady did not care. None of them. It wasn't until we got into labor and delivery where we saw an ounce of care or sympathy for her. Before then, they can care less. She did not care if she gave birth in that wheelchair. That was not her problem or her concern.
So let me make sure I got this right. Nurses were running to the emergency entrance with gloves on. They were ready. They saw the emergency. And then they looked at the car, saw it was a Black woman, and suddenly it's, oh sorry, ambulances only, go to the front. What changed between running to the door and telling her to drive around? Because I'm confused. And then, the receptionist tells her to go find a wheelchair by the vending machines. Like it's a treasure hunt. Go search for your wheelchair somewhere between the Snickers and the Sprite. The only thing that should be happening is someone running with that wheelchair, not giving directions, like she's looking for the bathroom. But here's where it gets me tight. The woman is on her hands and knees in the back of the car saying, "The baby is in my arse," which again means the baby is coming right now. And they hand her a stack of papers. They really said, we can't do anything until she signs these papers. Baby, the only paper that matters is the paper towels you're gonna need when this baby hits your floor. You looked at a woman in active labor and thought, but did she read the privacy policy though? Where are your priorities? And that charge nurse, standing in the doorway, watching, while Karrie is screaming through contractions, talking about, I have to do the paperwork and get her a band before we can send her upstairs. The baby doesn't care about your wristband. The baby is not checking for proper identification. That baby said, I'm coming now. And your response is, bureaucracy. Make it make sense. So Cash Jones said what she said. They do not care about black women or their babies. And I know some of y'all are uncomfortable with that statement. Some of y'all want to say, not everything is about race. Cool. Let's bring in an actual OBGYN who's been doing this for years and see what she has to say about it. Because maybe you'll listen to the doctor.
Watching that video, I'm disgusted. That should never happen to any patient. But Black women, we know the story far too well. We are treated like we're invisible in the medical system, especially when we're in pain. As an OBGYN, I've taken care of countless patients in that same exact situation, crying out, scared, hurting. When someone is in pain, your job is to move. You assess what you can, and you take care of the human being in one of their most vulnerable moments of their life while they're bringing life into the world. There's no excuse for that healthcare provider and what they did to her. I became an OBGYN because I saw how the system treats Black bodies. I watched my mom get ignored. I watched my dad die because he wasn't listened to. All my years of medical training, no one taught us the truth. I know the truth because of my lived experience as a Black woman. No one taught us that Black women are 3 to 4 times more likely to die from pregnancy-related causes. No one taught us that the instruments and techniques we still use today were developed by experimenting on enslaved Black women without anesthesia, without their consent. This history is not ancient. It's the foundation of our healthcare system. And I work within this broken system to try to push it forward, but we are still fighting just to get people to acknowledge that racism in healthcare exists. And if this video didn't surface, so many people would still swear this doesn't really happen. Share the video, spread awareness. It is not fair that Black patients still have to advocate for themselves, especially while they are in labor. But awareness is the first small step in a very long fight to make sure Black women get the care, compassion, and humanity that we deserve.
3 to 4 times more likely to die. Not a little bit more. Not slightly higher. 3 to 4 times. And you really want to sit here and tell me that nurse's behavior had nothing to do with race? You really think if Becky was in that wheelchair screaming about the baby coming, that LaCrista would still be calmly asking about previous pregnancies? Because I need whatever you're smoking if you believe that. And here's the thing that makes me so mad. The instruments we use in labor and delivery. They were tested on enslaved Black women without consent, without anesthesia. Our entire medical system was built on Black pain. And clearly some of these nurses are still operating. Like Black pain doesn't matter. Like we're exaggerating. Like we can just wait. Well, Karrie couldn't wait. And neither could baby Cash. And now we gotta talk about what happened to that baby because of this mess. And it's not good. So remember I said we needed to talk about baby Cash? Yeah. Because of all that stress, all that waiting, all that paperwork over people nonsense. That baby came into this world with complications. And I need you all to hear this from the grandmother herself, because this is the consequence of what happened in that waiting room.
Hey guys, I'm here with Mom and baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He still have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and the fluids was green, and like I said, he born with his eyes open. So they are, taking all that in consideration as well. But he's eating well, sleeping well. looking good. And I was also reading a lot of the comments, and some of you under the impression it was twins. They are not twins. This is daughter with baby Cash, and this is other daughter with baby DJ. They are a month apart. DJ born 10/10 and KJ born 11/11. Thank you again for your support and your concerns, and we will most definitely keep you updated.
Born with his eyes wide open. And honestly, I don't blame baby Cash. He took one look at that waiting room situation and said, "Oh hell no, I need to see everything because clearly these adults don't know what they're doing." That baby was more alert in his first 30 seconds than that nurse was during the entire shift. Cash really said, "If nobody else is supervising this disaster, I guess it's on me." But here's what's not funny. That baby had a bowel movement inside the womb. That's called meconium aspiration, and it happens when babies are in distress. Meaning all that stress, all that trauma, from being kept in a waiting room while his mama screamed, affected him. He's got to go through multiple tests now. Multiple doctor appointments. All because somebody thought paperwork was more important than urgent medical care. And Dallas Regional Medical Center, they put out a statement saying they're committed to providing compassionate care. Baby, the only thing you're committed to is getting hit with a lawsuit. You're committed to compassionate care the same way I'm committed to going to the gym, which is to say, not at all. It's just something you say to sound good while doing absolutely nothing. Now, some of y'all think this is an isolated incident. Some of y'all want to believe, well, this was just one bad nurse at one hospital. Okay, so explain this. Because literally, just days before Karrie's story went viral, another black woman had an almost identical experience. And this one will make your blood boil.
A mother in labor was wheeled out of a hospital, removed from the hospital just to give birth 8 minutes later on the side of the road. Her baby is okay, thankfully. This is the hospital that I had problems at, so that's so great. She tried to get them to keep her there, but they refused to keep her there, and she had her baby on the side of the road 8 minutes later. Yeah, she went to a different hospital, and I don't blame her because it's ridiculous. And I'm just gonna have you guess what color skin she has. Just guess. Yeah. Just ironic that this is happening after just seeing the video. I don't even think it's been a week since the other video that I saw that just completely enraged me. But seeing this happen literally directly where I live makes me so mad. It just makes me so angry. Yeah. All right, making myself really small so that you can pause and read it if you would like to. There's more, but I hope they share their story because it's enraging.
Y'all catching the pattern yet? Woman in labor. Black. Hospital sees her. Hospital suddenly has a problem. In Karrie's case, they kept her in a waiting room doing paperwork. In this case, they kicked her out, and she gave birth on the side of the road, 8 minutes later. 8 minutes. That baby went from emergency room to emergency road. So when black women tell you the healthcare system doesn't care about us, this is what we're talking about. Not theories, not feelings, receipts, video evidence, 36 million views worth of proof. But sure, let's keep pretending race has nothing to do with it. Let's keep acting like these are just unfortunate incidents. Let's ignore the fact that black women are dying in childbirth at 4 times the rate of white women and pretend it's all just coincidence. And before you all flood my comments with not all hospitals or not all nurses, yeah, we know. But enough hospitals, enough nurses. Enough that black women have to go into labor scared because we don't know if our pain will be taken seriously. We don't know if we'll be the next viral video. We don't know if we'll even make it out alive. So here's my question for y'all, and I want you to think about this before you comment. If this was your daughter, your sister, your mother screaming in that wheelchair, would you still be defending that nurse's behavior? Would you still be saying, well, hospitals have protocols? Or would you be in that hospital ready to catch a charge? Drop your thoughts below. And if you think I'm being too harsh on that nurse, well, baby, you're part of the problem.